Hello class, this is instructor Muriel Howard, and today we will be breaking down coding cases for BC3020 week 4. This week we will cover radiology coding, which also includes interventional radiology, which is a subsection of surgery. Some of these procedures are done in a surgical setting, where the radiologist will do a biopsy or perform specific examinations to determine if the patient has cancer or what the problem is associated with one of the organ systems. We will begin by reviewing one of the cases in your week 4 coding applications, and I will break down the information therein and show you how to abstract your information to complete your test successfully. Let's get started. Here we have a case scenario for an interventional radiology services, and as you see, I have highlighted the pertinent information related to the location, the primary care physician, and the radiologist, and the type of service. What you will do is download your coding examination in a Word document, same as you see here, and follow along with me, highlighting the same information that I have highlighted for abstracting. We see that the location is outpatient hospital. We see who the patient is, but that's not important today because we're only coding, we're not billing. We see who the primary care physician is, but in this case, since it is a radiology service, the actual provider providing the service on today is the radiologist. The examination is also what the procedure is that was done today. We see that we have a CT guided liver biopsy, which basically means that a certain type of radiology service, which is a computed tomography or a CT scan, was used to assist the provider in capturing the biopsy of the liver. The patient's clinical symptoms, which could be considered one of his diagnoses, is a liver mass. In real-world coding, this would be considered the reason for the service or the reason for the visit. Now, as we continue, we will review the report to determine what the services were. We see CT-guided liver biopsy. The details in the case explain how the services were rendered and any other services or procedures that was done or rendered during the time of the biopsy. These first few sentences just explain how the patient received service, the preparation of the scan. A lot of this information could be considered unnecessary simply because these words here does not change the actual service that was rendered, meaning none of this information will be separately coded. And what I'm looking for is a strike. So as we move on, we see that the provider gave the patient some lidocaine, which is another form of anesthesia, similar to what the dentist injects your mouth with, or what you will receive an injection for if you're going to get stitches. It just numbs that area. This particular type of anesthesia is considered local, and if you remember anything from previous courses dealing with surgery guidelines, local anesthesia is always included in the service. So this service would not be coded separately. So as we continue on, we'll see that the provider used a 19 gauge needle, and he used the needle while reviewing the CT scan to determine exactly where he's placing the needle and confirming the needle position, to remove some samples. We see here that the provider removed 4 core biopsy samples from the liver. It also tells us that biopsy samples were obtained using a 20 gauge monotype biopsy gun. Anything that is done with the help of a needle is considered percutaneously. So this is a CT guided liver biopsy done by way of percutaneous injection, or the samples were removed percutaneously with a needle, and the provider used a CT scan to help guide the needle into the appropriate places to remove the mass. It tells us here that the patient did not receive conscious sedation. So that's important because we do not want to code for something that was not rendered. So we're not going to code for that type of anesthesia. And then it's basically following up by telling us that he tolerated the procedure well and left the radiology department in stable condition. Now, the provider's impression, because he's the radiologist, is that he removed an uncomplicated, or completed an uncomplicated CT-guided biopsy of a low-density mass within the dome of the liver medially. Medially is similar to on the side or side of the liver, not necessarily in the front or the back, pretty much either the left or the right side. So this is a full description of exactly what he rendered. Pretty much it's the same thing being duplicated throughout the report. So it's only one procedure, and the procedure will remain the same unless when we go to the CPT manual, we locate more coding instructions related to this type of biopsy. But for now, we have the procedure and how it was rendered and where. The procedure is the CT scan or the liver biopsy. That's the actual overall procedure. How it was rendered is CT guided. Where it was rendered is the liver. Now, since they were biopsies are samples that the provider sent for further examination to determine what type of mass this is. We have a pathology report. So the pathologist has reviewed this particular sample, and now he has a confirmed diagnosis of primary malignancy of the liver. So we've completed our procedure portion. We have a diagnosis for the reason for the visit or the clinical symptom, which is a liver mass. But since the mass was further examined or had a further examination by a pathologist, we have one diagnosis: primary malignancy of the liver. So what should be coded? We're not going to code the clinical symptoms simply because that's just a sign or symptom. One of the rules of diagnosis coding is that you code the sign and symptom if there is not a confirmed diagnosis. So since we do have a confirmed diagnosis, this is the only diagnosis that we will use for the day. Now what I'm going to do is show you how to search for or use your proper search terms for your procedures or procedure, it's actually two, and your diagnosis. Okay, so here we are in the CPT Index, And mine looks a little different than yours because I'm using an electronic version of a CPT, or basically coding manuals. But the very first search term is what is done. CPT deals with procedures, services that are rendered. So I've already input the word biopsy, and I'm in the index under the word biopsy. So we need to know, or we need to search for, where the biopsy was done. So as you can see alphabetically, the provider could have rendered a biopsy on almost any organ or any body part. So what we do need is to look for the word liver alphabetically down our list. So we have the biopsy of the liver, and as you can see, we have a few options here. We're seeing that we have 47000, which gives us the biopsy of the liver, and the way it's done is percutaneously. Now we have parenthetical notes underneath this procedure explaining that if imaging guidance is performed, see these codes right here. So what we want to do is verify or do a process of elimination of other biopsies that fall on the same page in your CPT book and in your coding manual. We have 47001, which is an add-on code, and this is only used when the biopsy is done for indicated purpose at the time of another major procedure. We see that according to the report, the provider only rendered the biopsy. There wasn't any other major procedures done along with the service, so this can be eliminated. We have 47100, biopsy of liver wedge. The provider did not indicate in his report that he removed a wedge. A wedge is basically a bigger chunk of the organ, and we're now moving down to another body area or another organ, which is the biliary tract, and that does not match what was rendered on today. So we're safe with 47000, and then we have to review these codes associated with imaging guidance because the provider used the CT scan to help him render this service. Now we have ultrasonic guidance. We know that the provider did not do ultrasound. Ultrasound was not mentioned in the report. So we're going to continue to move down until we find a code that, or a radiology code that best matches what was rendered on today. We see fluoroscopic guidance. The provider did not mention anything with fluoroscopy. And we have computed tomography guidance, which is also known as a CT scan. So, of all of these type of guidance or radiology guidance codes that are in our options for choice, the one code that best fits what was rendered on today is the one with CT or computed tomography guidance. So there you have we have abstracted all the important portions of the report. We have coded the procedure. Now what we need to do is focus on the diagnosis portion. And as you do your coding exam, you're going to run into various questions and different abstracting portions. You would just process every claim or every chart or every case in the same manner that I'm explaining to you today. You highlight what's important, you cross out or ignore what is not important and what cannot be coded separately, and you move on down through the case. Make sure you find your complete diagnosis, because as we can see in this particular scenario, the patient started off with one diagnosis, which was a mass, and then ended with a different diagnosis after examination. So after the pathologist reviewed the sample, he determined that the patient has malignant neoplasm. Let me review primary malignancy of the liver. So now we have neoplasm, which we have to go to the neoplasm table in the index. And then we have primary neoplasm. That just says neoplasm. And here, this, like coding neoplasms, it's actually best to look in the manual, simply because looking up things electronically like this may pull you into the wrong category of codes. And we want to make sure that we code accurately. Excuse me. See, neoplasm, malignant myositis. So I'm given a search term here to look for the liver. Okay, neoplasm of the liver. We have malignant primary. So I am going to check this code, and I'm taken to the index, and this is actually the tabular list. This side of my software is showing me my alphabetic index. That's why I'm looking up the words alphabetically. I'm pretty much coding in the same manner that we've taught you throughout the program. You start here alphabetically in the alpha index, and in this particular scenario, you would have ended up on your neoplasm table. And then from there, as we can see, the provider says it's primary, and we know primary is the first site that this particular malignancy has appeared in a patient's medical history. And so we're going to the alphabetic, and the alphabetic index is also, the tabular list, which is where the codes are listed numerically, or we can't say numerically anymore because now we have alphabetic. So we have malignant neoplasm of the liver and intrahepatic bile ducts. And also it excludes all those different areas. Liver cell carcinoma, that's not what's listed. I think the best fit for this particular diagnosis or service or pathology report is one of these two: malignant neoplasm of liver, primary, unspecified as to type. Now we have malignant neoplasm of liver, not specified as primary or secondary. The provider listed it as primary. And we always want to review our instructional notes associated with coding malignancies. So in the Chapter 2 of the ICD manual, I don't know if you guys can see this. Let me raise this up. We have notes related to malignant neoplasms. We have different types of neoplasms listed. So you always want to review your notes in your tables just to make sure that you're coding accurately and that you do not need to add an additional code, because sometimes you have to add more specific codes related to neoplasms. But in this case, we're pretty much safe with C220.8. Now, if you find something in the actual book that's more accurate, then by all means use that. But as you can see, I'm using an electronic ICD manual, and as I say, it's not always guaranteed that your coding will be accurate using any other system except for your ICD-10 manual and or your CPT manual. And so this is it for this case. Remember, process all of your cases in the same manner. Go back and forth and review the different portions of the case for abstracting to answer your questions clearly, and reach out to your instructor and or myself if you have any questions. Thank you for viewing. Have a great day. Bye-bye.